me vois? Donc, c'est bon? Si.
Dr. Django. C'est ouvert. Pardon?
Good afternoon, ladies and gentlemen. May I call the House to order? Ara kuchu kuchu balu. Please remain seated. We are going to start the afternoon session. Anta number ko magazine number. Okay, very good. Ladies and gentlemen, honorable ministers, in the morning while the ministers were having their meeting, there was a discussion about information revolution. And we had an excellent panel, so my duty for now would be to summarize what was discussed and request the Honorable Minister for State of Uganda to make a reflection at the end. We kicked off the panel with an excellent remark from Dr. Ajay of India, who basically talked about using data for action in RMNCH and adolescents. He talked about different data sets and use in the area of reproductive, maternal, newborn child health. And he also talked about use of survey data to prioritize geographies. So in India, they periodically, based on performance and based on the various data sets they have, they prioritize districts and provide technical assistance, support, resource allocation, and so on that can potentially improve the performance. So they have around 209 high priority districts and so on. And he concluded his remark by explaining a scorecard that they use, which uses the regular health management information system and is used to drive performance. Then we had Theo, who talked about the importance of data use partnership. He explained the need for a culture transformation, a culture change to make sure that information use requires significant change in culture, or the mindset revolution as we call it. And he also explained systematically on the strategies that should be implemented to achieve that and to have a good data that can be used for decision making. As we all know, the routine information systems now are very weak and produce poor quality. So there is a need to make sure that we change this going forward. He had proposed a number of strategies to increase use of information, quality information, including the creation of information culture, capacity building, and so on and so forth. The third panelist was our colleague Emmanuel Mugisha from Uganda, and he talked about evidence-based advocacy, so data that is collected from community, health facility, district, national level, how they are used to really advocate for the right kind of strategies and implementations. We had Jennifer, who talked about the countdown to 2030, and she has explained the partnership model and the different approach that they would like to introduce as countdown to 2030, the UHC agenda. And as we are talking about equity, quality, and so on, it's really important to have a good quality measurement in place to have the desired impact. And regional and country networks are important avenues that can help the achievement of such results. Jennifer emphasized the importance of engaging civil societies to make sure that the data that is reported is actually used to hold ourselves accountable. We had a very interesting presentation from the Last Mile project by a representative from Coca-Cola, Philip, who talked about how one can leverage, the efficiencies of the private sector and the simplicity of data and how that can be used to improve delivery of products to the last mile. As we know, you can find Coca-Cola in every village in Africa and elsewhere in the world, and their supply chain management system, and how they are tapping the informal economies and systems to actually identify the needs and deliver products timely and ensure quality is something that the public health sector and the health sector in general can benefit from. I hope I would have Philip give more example of the various initiatives that they have started as part of this next panel, because we will be talking about partnerships, and partnership with the private sector is something that will bring in lots of efficiency to public health systems. The last speaker was PMA